and welcome to this press conference. My name is Mark McDonald. I am a barrister and I represent Lucy Letby, and I have been her barrister now for 3.5 months. And in that time, we've made significant progress, and I'm going to make 2 announcements today. One statement is from me. The second is from 2 consultant neonatologists, Dr. Neil Aiton and Dr. Svelena Dimitrova. Let me deal with the first statement from me. Today, the defence are announcing that they will be immediately seeking permission from the Court of Appeal to take the exceptional but necessary decision to apply to reopen the appeal of Lucy Letby and immediately review all her convictions. In August 2023, Lucy Letby was convicted in the Crown Court at Manchester after a trial lasting 10 months, 7 counts of murder and 7 counts of attempted murder. On the 24th of May of this year, the matter was before the Court of Appeal, but all applications for leave to appeal were refused. The primary ground of appeal at the previous hearings related to the admissibility before the jury of evidence from the lead prosecution expert, Dr. Darry Evans. The defence argued twice at the trial that Dr. Evans' evidence should be disregarded. This was refused by the trial judge. It was then later argued in the Court of Appeal. That was refused by the Court of Appeal. Remarkably, Dr. Evans has now changed his mind on the cause of death of 3 of the babies, baby C, baby I, and baby P. Dr. Evans had said to the jury that Lucy Letby had injected air down a nasal gastric tube and that this had led to the death of the 3 babies. This was repeated to the Court of Appeal, who may have been misled when they ruled on the applications for leave of conviction in the May of last year. Dr. Evans has also said that he has revised his opinion in relation to baby C and has written a new report that he has given to the police. This was some weeks, actually months ago now. Despite numerous requests, the prosecution have yet to give this report to the defence. The defence will argue that Dr. Evans is not a reliable expert, and given that he was the lead expert for the prosecution, we say that all the convictions are unsafe. The second statement I'm going to read relates to fresh evidence relating to 2 very detailed and lengthy reports, one on baby C and one on baby O. And let me read out the statement by the 2 neonatologists. We have been instructed by solicitors representing Lucy Letby, and so far we have examined 2 cases, baby O and baby C, in great detail and presented joint reports. To prepare these reports, we had full access to the following: the hospital notes, the post-mortem records, multiple reports of David Evans, as well as other experts' witness statements and statements submitted as part of the pre-trial investigation. I should also add, as well as transcripts of the trial as well. We have taken considerable time and care, and these reports provide a thorough analysis. Our reports demonstrate that there are identifiable medical reasons why both babies became unwell, sadly did not respond to resuscitation and subsequently passed away. We have set out clearly within our reports evidence showing that these babies could not reasonably be described as well or stable. Neither should their deteriorations be described as unexplained. Our reports contain careful, justified new evidence which has not been presented before, either in court or as part of previous examinations of these cases by multiple sources. It is not our role to determine any impact this new evidence might have on the legal process. Although some of the medical information within the report is complex, it is possible to draw clear and sound conclusions which we believe will stand up to scrutiny. In this respect, we are completely happy for our reports to be subject to appropriate independent expert critical analysis. We have provided evidence that baby O died due to issues relating to the resuscitation. Baby C died due to problems caused by failing placental function at the end of the pregnancy. We have seen no evidence of deliberate harm to these babies by anyone. Despite the huge public interest, we fully understand the reports have now been submitted and we cannot make further statements or comments at this stage. The release of limited experts or brief soundbites would not do justice to the detailed arguments and conclusions made within the reports as a whole. That last paragraph, in effect, they are not going to be making any more public comments about their own reports. So I'll open the floor up. Any questions?
I've got one.
John Sweeney.
Yes, so John Sweeney, you say that Downey Evans should no longer be considered to be a reliable witness, a reliable expert. Can you expand on that?
Yes. Dr. Evans has given a number of interviews following the conviction of Lucy Letby to newspapers, documentaries and podcasts. In those interviews, he has said a number of things and has said things that are inconsistent with some of the evidence that has been served and that I have seen. That's the first issue I have with him. I think it's remarkable that an independent expert who gave evidence for the prosecution continues to speak to the media and is continuously on TV and in podcasts and giving interviews, but that is aside.
Can you explain in simple terms what he said in court and what he said since?
Yes.
And why that causes you trouble?
No, of course I will. So we know that he was the lead prosecution expert and he was the first person to examine the notes of the babies and give the first initial reports. He has come up with, in essence, 3, maybe 4 ways that he says collapse was due to these babies, of which some of them ultimately died. Air embolism being a primary one. Second to that is air, he says, being injected down the nasal gastric tube, causing a splinting of the diaphragm, which has led to suffocation, which has led to the death. He has now said that that is not how the babies died. He said that 1 year after Lucy Letby was convicted. So you have a person who went before the jury, gave one theory, and then has now said that that is not the theory that he doesn't longer stand by. He says that is not how they died. Now there is one caveat to that, and that's baby P, because in baby P it's slightly confusing because it's air down the nasal gastric tube, but he also added, it would seem, air embolus as well. So I put that caveat in my statement, but certainly in relation to the other two babies, that is correct. And that's what the Court of Appeal was told. And that's the important thing. Sometimes Dr. Evans did change his view, certainly on one occasion, whilst giving evidence. But the Court of Appeal were not, the prosecution did not stand by that in the Court of Appeal. They said the child, particularly baby C, died as a result of air going down the nasal gastric tube. And that's what causes us concern. So we say, and it's a theory that we need to put before the Court of Appeal, that we want them to reopen their the last judgment and to re-look at it and to decide whether or not this lead expert, is reliable. And if it's not reliable, then all the convictions, we say, fall.
Mark, Charlotte Lynch from LBC.
Hello.
Presumably Lucy let me know you're making this statement today. How does she feel about that and the prospect of the case being reopened?
Everything I do is with the consent of my lay client and my professional client, my instructing solicitor. How would you feel? How would anybody feel? You're a 34-year-old woman, you've been sentenced to life imprisonment without any hope, and suddenly we found such profound and significant evidence that may possibly overturn your conviction. I leave it to you to decide how you would feel about that.
Yeah, my name's Richard Taylor. I'm a neonatologist from Victoria, British Columbia in Canada. But as you can tell from my accent, I'm originally from the UK. In fact, I trained at Barts, qualifying in 1980. So with regard to these reports, I've only read one of the reports in full, and that is the report on baby O. I should qualify this by saying that I have not seen the medical records myself, but I have read the full report. And to summarize the medical evidence, baby O was doing reasonably well. There had been some concerns with abdominal distension, which was possibly related to excess gas going into the gastrointestinal tract. The baby had an apnea, and the medical staff, an apnea is a pause in breathing, and the medical staff responded to this by intubating the baby, placing the baby onto a ventilator, and the baby was not unwell particularly, but it had an apnea, but they placed the baby on a ventilator and then put the baby on very high pressure settings. So in neonatology, when we ventilate babies, we ventilate by pressure rather than by lung volume. And this baby was placed on very high pressure settings, inappropriate for the fact that the baby actually had no lung disease at all. So the baby was being ventilated on very high pressure settings. Again, the nurses were concerned that the medical staff had actually left the unit. They then came back. Things didn't look quite right, and to summarize what happened, the nurse was again concerned that the abdomen was distended, and one of the doctors responded to this by placing a needle into the abdomen. So they directly aspirated the abdomen, and they chose to use a point which in medical parlance is called McBurney's point. This is a description of the point that is used for performing an appendectomy. The baby did not need an appendectomy. This is a newborn. Appendectomy is completely irrelevant to it. If an aspirate was going to be attempted, it should have been done on the left side, but in fact the doctor used McBurney's point, which is on the right side. As I have already said, the baby was on very high pressure settings, and this is confirmed by an X-ray of both the abdomen and the chest. And the settings were so high that the baby's liver was pushed right down into the pelvis. So when the doctor performed the aspiration of the abdomen, the needle perforated the liver. The baby was still being ventilated with a needle in the liver. The liver was now being lacerated by the needle. And this led to bleeding, free blood going into the abdomen. The baby went into shock. The shock was actually confirmed by a subsequent blood test, which showed that the baby's hemoglobin had halved, and they were unable to resuscitate the baby, partly because they didn't realize what they'd done.
What was the name of the doctor?
I don't think it's right that we name names at this stage.
I think the doctor knows who they are.
We don't.
I know. I have to say, from a personal point of view, that if this had happened to me, I'd be unable to sleep at night, knowing that what I had done had led to the death of the baby, and now there is a nurse in jail convicted of murder.
Having looked at the evidence, how strong do you think the evidence against Lucy Letby is compared to your theory? That, as I understand it, the doctor accidentally killed the baby by mistake.
The claim was that I think that Lucy Letby had injected air into the baby. I'm not even sure what the prosecution was claiming, but it's nonsense. Complete nonsense. The baby died from shock, from a liver perforation. The report stands out, and I understand that the report is partly based on, well, it's fully based, in fact, on the medical records, and the medical records actually include a statement that an aspiration of the abdomen occurred at McBurney's point.
Is it surprising that that wasn't discussed in court?
Very surprising, yes. I don't think that the case was reviewed very well. It's also surprising that it didn't come out in the autopsy. But I understand that the information that an attempted aspiration of the abdomen had been made, this was not conveyed to the pathologist. The pathologist was unaware of that. Did the doctor know what they did?
Yes.
If it had been me, I think, yes. I don't know whether they felt uncomfortable about it or what. I can't comment on that.
Can I ask if the doctor gave any evidence in the case against Letby?
I believe so. Yeah.
Was the doctor granted anonymity while giving evidence?
No.
May I
You
add
can-
something?
Yes. Do you want to come up and?
No, it's a very short point.
Okay. Yeah.
I'm aware that the second prosecution expert felt that the needle had been inserted at a level higher than McBurney's point, and of course that would mean that there would have been a much even greater chance of the liver having been perforated by this inappropriate action during resuscitation.
That's yes.
And that
Yeah.
they were aware of this.
Yeah. Apparently there was a photograph, and the incision mark appeared to be higher than McBurney's point, which makes it even more. So it makes it even more consistent with an injury to the liver. And the other part of it is that when the needle was inserted and the doctor aspirated, instead of aspirating air or clear fluid, he aspirated blood. And the liver is a very vascular organ, so that fits with a needle in the liver. Obviously, I live in Canada, and so my introduction to the Lucy Letby case was on visits to the United Kingdom, and so the first I heard about it was last year during the trial. I was incredibly surprised because if you look at the history behind this and you look at Lucy Letby herself, you see a nurse, and nursing is an altruistic profession where people, especially in this country, people nurses don't go into it for the money. They go into it because they want to help other people, almost universally. And I think that applies to her. She has no past history of any antisocial behavior, any criminal behavior, any psychiatric problems at all. There is no motive. Her friends are all completely astounded, flabbergasted by the accusations that were made against her. And so that immediately, for me, brought up red flags. Said, well, what on earth's going on here? What is the evidence? And then when you go further into it, and the evidence is based on really one expert witness, a pediatrician who retired 15 years ago from clinical practice, who actually went and volunteered his services, actively volunteered his services to the Crown Prosecution Service when he discovered that there was an inquiry going on. I do medical legal work. I don't go to the police or to lawyers to volunteer my services. They come to me. And I work for both sides. I work for the prosecution and for the defense, the plaintiffs and the CMPA in Canada. Roger, you want to say
yes,
something?
I think I'd add that I, as with many doctors who've seen evidence, and particularly the testimonies given by Drs. Bowen and Dr. Evans in court, I and they were absolutely astounded by some of the responses in almost every case that were given, particularly by Dr. Evans. He seemed to me to have broken the rules of the criminal procedure rules by always completely refusing to consider any other diagnosis than that which was the only possible diagnosis that he had come up with. And his duty to the court and to the jury was to give a range of opinion, and he constantly refused to do this. He had an opinion and he would not be moved. And of course this is not in the least bit surprising, because not only was he the lead prosecution doctor, he had worked with the police creating the theories. So it was impossible for him, when he came to give evidence, having created the theories, how likely is it that he could possibly have suddenly disagreed with himself? So he was not going to do that. And this is what has been so astounding to many doctors and experts who've seen evidence and who do not know Lucy Letby. I don't know her, and I think, Mark, you'll say it's almost unprecedented that 50 or 60 or more experts have come out of the woodwork to defend somebody on the basis of what we regard as absolutely appalling and unsustainable medical evidence.
I understand that Dr. Evans actually proposed varying causes of death. Air down the feeding tube was one of them, but air embolism was another one. There are really no experts on neonatal air embolism, and so that makes it a little bit difficult to challenge Dowie Evans, because he hasn't seen it himself and I haven't seen it. I can give you my own impressions about air embolism, because some of these babies, after death, they actually did have x-rays performed. Now, air consists of 20% oxygen, 80% nitrogen. If it accidentally goes into a blood vessel, the oxygen will eventually get absorbed because the tissues will use oxygen that's needed for life. So eventually the oxygen will get absorbed, but the nitrogen will persist for some time. And so when air enters the circulation, even some minutes later, or hours later even, I would expect the air to still be present in substantial amounts on the X-ray. And that wasn't the case, as far as I can tell. I haven't seen the X-rays myself, but apparently there were minute traces of possible air which were consistent with resuscitation attempts. Minute amounts of air will be seen after placing an umbilical venous catheter, because often a little bit of air gets entrained when an umbilical venous catheter is placed into a baby, and we can see that very clearly on an X-ray. It doesn't cause them any harm. So it would have to be a very large amount of air to actually cause harm. And one would expect to see that either on autopsy or on X-ray. That's as far as I can tell, because I've never seen a large accidental air embolism. The remarkable thing about the insulin baby was that some information that actually only was released publicly in the Thirlwall inquiry, and that was the actual insulin test result, which went to Liverpool, and the test result shows a slightly elevated cortisol level, a sky-high insulin level, a low C-peptide, or a normal C-peptide perhaps, but also what was missed, an incredibly high blood glucose value. And that was completely inconsistent with the clinical findings on the baby, where bedside glucometer measurements were extremely low, and in fact that was why the insulin level was measured. And yet the blood sample which contained which was used to analyze the insulin actually read 999 millimoles per litre glucose, flagged high and verified. That information appears never to have come up in court. It was not mentioned by the prosecution experts. There was no defense report, and it was never even brought up in court. Why?
And Richard, can you tell us what that might be an indication of?
999 millimoles per litre is what the machine will give you if it's so high at the high end that it's off the scale. So it's actually higher than, I think, 54 millimoles per litre. It's just ridiculously high. It's just stupidly high. So we have two stupidly high numbers. The high insulin number, which was the one that the experts focused on, but the high glucose, which was completely ignored. So, okay, so the high glucose value in this sample can mean a number of things. It could be a misprint. It could mean that the machine broke and churned out something. That doesn't really fit very well because it was verified. The most likely thing is that the sample was contaminated. It was contaminated, and that's what led to the very high glucose value. If it was contaminated with glucose, it could have been contaminated with anything. As a forensic test, you've got to throw it out. It was contaminated. It's right there. It says 999 millimoles per litre. It's ridiculously high. And you'd get a result like that if the sample was drawn from a line that was running glucose, because the baby was receiving glucose. So if you actually pull back on the line that the baby was actually getting from, then you will get contamination with glucose. If that same line was used for the insulin infusion, which the baby had received a few days earlier, insulin will stick to the walls of the line, and that will also contaminate the result. But in any event, when you've got such a high glucose result, plus you've got other things like lipid and so on and so forth, it makes the insulin result really unreliable. The insulin number was about 40 times as high as I've ever seen in my career. It's ridiculously high. Something obviously suspicious about it.
But the insulin cases are crucial, because the insulin cases are the first two cases to which the jury reached a verdict on of guilty. So they are important, but it's also the two cases where, albeit it wasn't the defence case at the trial, but Lucy Letby, under cross-examination, accepted the results. Now, the next question is, if you accept the results, but we now found out they're unreliable. And if I can draw an analogy, it's probably not the best analogy, it's almost like a post office master pleading guilty to a crime they haven't committed because they got told the software was accurate, and now they're told it's not.
Yes, Lucy Letby was in no position to answer that question. She could not have known, she would not have had the medical knowledge to be able to give an informed answer to those questions.
And she also didn't see the result.
Well, she didn't see the important evidence. No. All right, John.
Last question.
Okay. Did you want to ask a question as well, Stephanie? Was you going to put your hand up there? Okay, John.
Lady Justice Thirlwall has said that to question the conviction is noise. What would you say to her?
There's always my job, my role is to represent my client to the best of my ability. I see fresh evidence that casts doubt on the safety of the conviction. I have to do something about it. Lady Justice Thirlwall is an incredibly experienced judge, and she has a very specific role within that inquiry, and I'm sure she's doing it to the best of her abilities. And if she finds this intervention distracting, then I can only apologise. But if I've got fresh evidence that says that my lay client convictions are unsafe, I have to do something with them. All right, no more questions. Thank you very much for coming today.